This afternoon I'm really serving as a moderator. You'll hear a little more from me tomorrow about some of the Mayo Clinic perspectives on accountable care, precision medicine. But this afternoon it's my privilege to introduce a panel going to be talking to you about really the guts of any future care system, and that's the information management systems and the information technology we need to bring us all together. I'm pleased to introduce three speakers for you this afternoon. And as I am doing the introductions, you should be seeing on the screen on the left or the right some questions that we would like you to answer while we're doing introductions, and then we'll get to the speech, and I will be sharing with you the results at the end of the time. The first speaker this afternoon is Phil Fasano. Phil joined the Kaiser Permanente system in 2007. He's the Chief Information Officer of Kaiser Permanente and a Senior Vice President of that organization. His responsibility is the leadership technology function really across all of Kaiser Permanente, which is a huge job. He's also a member of their national leadership team and a member of the Kaiser Permanente partnership group. Your second speaker this afternoon is Dr. Tom Colaccio. Dr. Colaccio is the president of the Dartmouth-Hitchcock Health System. He's been with Dartmouth-Hitchcock since 1981, trained as a surgical oncologist, and he became a member of their board of governors and has been leading their organization now for 10 years. The third speaker is Mr. Jeff Margolis, and he's the chairman and chief information officer of TriZetto. The TriZetto company is dedicated to the innovative application of information technology. And really, he spends quite a bit of time every year working with other industry executives to really work with them regarding integrated management systems in pursuit of future directions in healthcare information. I would also add that Mr. Margolis is actually viscerally involved in information management systems. He has a book which I would recommend to you that I read over last weekend. And he has been a lifelong, or virtually since his teenage year, a lifelong sufferer of Crohn's disease. And in his book, he mentions a couple of times something that struck me as a physician quite clearly. He has had 7 operations for Crohn's disease. 3 of those operations were to make up for complications or errors that occurred in his care during the first 4 surgeries.